Okay, welcome to the Healthcare Nation podcast. I'm Rick Giannato, your host, and Ben Castro and I are in the studio right now, really doing a shakedown pre-episode number 1 in anticipation of having a series of fantastic guests coming up, really first to tackle the big challenges, right, Ben?
Rick, I am so excited. Thank you so much for having me on this podcast. And honestly, I'm can't tell you how much I've been waiting for you to come in because I am so curious. I need to know this information. I need some just clarity from you on all the stuff that's coming and what you're bringing to the table.
Let's start it off.
Yeah.
What's on your mind? And
okay.
I'll try to tackle it.
All right. So Rick, overall, what's the state of the union for the healthcare nation? Like, give me some trends. I also was pretty curious on the technology side about it as well. And I'm sure this is your forte. So if you could just let's dive in.
Sure. And first, let me just say full disclosure. Obviously, all the opinions expressed on the show are those of the host and not meant to be associated with any companies, industries, or educational institutions that I or the show are associated with. With that said, listen, Ben, I've had a longstanding belief that technology is a new biology, and similar to how biology informs an individual's health and wellness, technology will be equally as influential on not only an individual's health, but also on society's health and wellness. I really, really believe that. And in the health sector, kind of writ large, we will continue to see this exponential growth, particularly in the medical device space, the interface with wearable technology, et cetera. This will be accelerated by artificial intelligence and machine learning, obviously, and continue to rapidly evolve for an unprecedented level of advancement. I think that will really blow everyone's mind. When you connect that to what I call the Internet of Medical Things or the Internet of My Things, it's really going to, I think, open up the doors for incredible promise for health, wellness, treatment, discovery, and obviously a level, I think, of collaboration moving forward that hasn't ever been seen before.
That's amazing. I was going to say that the technology and just how we're continuously growing, things are just constantly in change. And that's amazing that you kind of, you know where we're going with this. Now, what about regulatory oversight? Can you tell me a little bit about that?
Yeah, great question. I'll tell you first, there's going to be a pace to all of this. It is definitely going to be influenced by regulatory policy, payment structures, the legalities, and everything that goes into the operability between states, the federal government, et cetera, and how society will really, embrace that, accelerate it, or create barriers that we know exist right now anytime we try to bring a new technology to the forefront. But to be a little bit more specific, I think there's some areas that are clearly top of mind for me. First, the FDA and their ability to address any new modality that's coming on board. We've seen this with the way they're recognizing artificial intelligence now. We know that that is going to continue to be something that needs to be watched. And any medtech or biotech company, I believe, has already got their eye clearly on what the FDA is doing if they want to move anything from a product or platform perspective forward. The next is that Medicare and other payment structures are going to need to adapt. They're going to need to continue to embrace technology and reimburse for it. I think I've always taught the 5 Ps. It goes into, there's policy, there is politics, there's payment, it trickles down to the providers, ultimately to the patient. We know that there's got to be a recognition that there is an economic chain here that needs to be addressed. A big part of that is reimbursement. We know that HIPAA privacy laws, obviously, the need to tighten that up has got to be, absolutely locked down and rock solid, and that we're going to need to be able to adapt to the I think far-reaching opportunities associated with technology that go across borders and states. So licensing regulations will need to accommodate this remote care. AI-informed healthcare advice will need to be parsed through. The algorithms that underpin these applications need to be thought through. So there's lots of different things that need to be addressed. And I'm happy to say there's a lot of folks, really, really bright minds that are doing that right now.
That's amazing. Rick, you've brought so much to my attention. I loved those P's. That was a really good point, and I think a lot of people could learn from that as well. Now, I want to go and move this over now. We've talked about the regulatory oversight, but what about the consumer's space? What's happening there?
Yeah, listen, I think this is probably one of the hottest areas. Certainly when you think about the health sector, if you take a look at the consumer space as a separate entity, and then look at what's happening in the healthcare space, it's nothing short of really incredible. I think the retail giants are going to continue to drive and accelerate a level of change and a different approach that is going to be, I think, very different than what we've seen before. They're going to dial into consumer preferences. They're going to look at digitally enabled on-demand services. They're going to look at having services within, say, a retail environment, a Walmart, which could very well end up being the rural healthcare provider for the United States. We'll look at new methods of connected clinician-patient interactions, and we'll look at a level of, I think, relationship that goes beyond this transactional patient health encounter to a positive experience that goes obviously into healthcare, but even beyond that, checking the boxes, if I dare say, into this almost retail, play. Now, a big part of this is going to be segmentation. And segmentation, I think this is where we look beyond what we may have historically thought about in healthcare segmentation, meaning provider type. I have a specialist or a commercial insurance versus, an employer-based, et cetera. Well beyond that, this is going to be segmentation that is in large part driven and targeted by generational issues, millennials, Gen X's, et cetera, gender, even episodes of care. If you look at what Roman has done and Rory, Hims, et cetera, really focusing in on particular, issues that are really important to folks that are out there and giving value and a value proposition that you probably can only find in a consumer retail-based construct.
Now, Rick, wow, that was now, what about digital health? What about digital health, though? I feel like that is something that is kind of looked over, especially it's really becoming present. Can you give me a little bit more information about that?
Yeah, I think, Ben, listen, when we think about digital health, it's like it's all encompassing. We have to think through what's our definition here. I'd like to probably start with that. Look, there's an underpinning platform, the Internet of Things. I mentioned in our preamble, the Internet of Medical Things, right? And the opportunity and influence that connectivity and access will have in that space. So imagine the things that you interact with right now in your home and having them really speak to you in a way that addresses health concerns. This is what we're talking about. So wearables, virtual health, other digital innovations. As I said earlier, once we get the data analytics and interoperability, then the IoT and the IoMT becomes something incredibly powerful. Now, let me harken back to what I was saying on the consumer space. We know this, the retail icons have spent just last year alone well over $10 billion on acquisitions of companies in the healthcare space specifically aimed at addressing this technology in the home, remote patient monitoring, et cetera. And this is an incredible, I think, sign of what's to come. And it's going to be very, very powerful for the consumer when you have information that heretofore you only got through your physician, through, literature search or, a specialist visit.
Yeah. And I think that it's very prominent now because, my parents are even huge advocates of anything with keeping up with their health and all that stuff. So, now what's something positive that we get out of this? What's the positive developments?
Yeah. I hate to bring up the pandemic when you say something like positive, but here's the reality. What came out of that was a level of public-private collaboration, certainly in vaccine development, the technology side, that I think has continued now. And I believe that from therapeutics, obviously beyond the pharma side, but really into med tech, even when we look at adopting some of these consumer models, it's an opportunity to break down and synthesize these historical silos that were really almost impenetrable walls between the provider space and medtech, pharma, and everyone else. So I think that what we're looking at from a positive side is, and a lot of this is driven by, I will say, private equity, venture, and the funding models. There will be new business, financing, and economic models. This is a must. We know things are tightening up right now. And I think we're going to see the opportunity and the promise that's out there in healthcare to be incredibly attractive to a lot, obviously on the financial space, but also the consumer retail that's going to drive this, public-private partnership and even consumer, medical, consumer, health sector partnership. I also think that this novel combination will lead to platforms, products, and services that will allow some new entrants in with some incredible, bold, and innovative ideas that will bring, I think, healthcare to another level and hopefully increase access to care for many people who don't have it right now.
I love that. Now, you did mention the pandemic, and, unfortunately, it sparks in my head is staffing. That's the first thing. Now, how do you go about staffing in that provided space? Is there a new way about it, or what's walk me through it. Yeah, walk me through that.
That's a great question. Listen, I will tell you this. I started my career as a nurse at the bedside. Staffing shortages, they've always been here. I think things are changing now, and they're locking down into a situation where we're not going to have enough qualified staff in the period of time to address some demographic changes that are happening. So there's this shift in workforce dynamic that I just mentioned. And when you add to that, what I would say is a real burnout factor that's happened across the board. A lot of this is this pandemic fatigue. Obviously, that has amped it up. But I also think that the models of care that we're using, it's antiquated when you think about technology and what is happening in other industries. We just haven't kept up. Now, that doesn't mean that at the bedside, we don't need a caring and empathetic individual to deliver care. That is a must. That can never be marginalized. That's just here. But our ability to have qualified individuals, physicians, nurses, other professionals in the allied health world to do that, it's getting tight, and we need new ways to address that. Part of this is going to be, reinventing our care models and really being innovative in that way and solving these long-standing issues of, quality, staffing shortages, overcrowding in EDs, et cetera. So our existing care models really need to adapt for that and change.
I love that. And that's good. I mean, especially to see all of the changes. I mean, we all have had to go through a huge change with COVID and just the way of regulations and all of those things. So that really, really opens my eyes. Now, I have any last thoughts to, I was thinking about that when you're doing these and helping people with the bringing the attention to the podcast and getting everyone involved, what are you looking to get out of this? What is it for you? What's for you, Rick?
Yeah, well, I'll tell you, there's a couple of things in terms of last thoughts. First, there's so much that we've got to look at and address moving forward, and I hope that Healthcare Nation, the podcast, is going to bring to light, I think, the longstanding issues, obviously the challenges, but I hope we also have equal time to emphasize the opportunities that are out there. Look, there are things that folks are dealing with right now, like Medicare Advantage. What's going to happen with that? Is it going to be the route for salvation for, a really fiscally stressed Medicare, monetary line item for the federal government? Same thing with Medicaid. What are we going to do with that from the state level across the board? Controlling costs. The big issues that are out there, the public health issues that are going to continue to intensify, everything from, maternal mortality to the fentanyl crisis, access to care, mental health, social determinants. I also think that the source of truth, who do you go to for your information? Can we trust those long-standing institutions that we know a lot of the healthcare nation and the nation at large out there have really, I dare say, have had some of their, faith in those institutions, shaken. So what do we hope to come out of the podcast? Look, we're going to unpack the big challenges. As I said, also the the opportunities. We're going to engage the thought leaders from across the sector in deep discussion, and we will revolve around and influence that discussion by what's happening in the world at that time, as well as what we anticipate in the future. We're going to start with the technology theme, specifically digital health, the electronic health space, artificial intelligence, and believe it or not, Ben, the metaverse. We're going to talk about its implications for healthcare. We're going to look at access, disparity, equity issues. We've got a phenomenal guest lined up for that. What are the innovative approaches to address those gaps? So absolutely important to bring to the forefront. We're going to talk about surgery and medicine, applications and advancements, how technology is playing a part in that, specifically oncologic surgery, cancer surgery in the brain, neurosurgery. We're going to have a leading expert to really unpack that issue and see what's out there to give hope and also, I think, reassurance that there are incredible minds working on that. Also, what's happening in the pediatric adolescent space with respect to innovation. We don't want to see kids as an afterthought, whether it's peds, adolescents, et cetera. We need to shine a light on that area. What's happening? What is innovative in that space? I think that is something we need to look at for this generation, this young generation. Integrative medicine. I've always thought that integrative medicine is innovative medicine. So we're going to go deep on that. And what exactly do we mean by integrative medicine? How can we leverage that modality to address everything from intractable pain to mitigating some of the terrible diseases that really continue to be a malady? And then finally, with this particular segment that we're going to embark upon, the big issues, we're going to talk about the ethics and the ethical really challenges that are going to, confront us and surround us when we have to address these complex decisions as we move forward with the advancements in technology and everything that we've talked about so far.
Rick, like I said before, I am so excited for you to launch this because me, as myself, I don't really know all this. I don't know a lot of these things. And I bet you, I know that there's other people just like me, clueless. And the fact, all these things that you brought to me and spoke about today blew my mind. And it makes me even more excited. Okay, so I'm really excited for this, and I think we're going to have a great time, and this is going to be awesome.
Let's have a great time. Keep your hands on the lever, keep us modulated, and let's make the healthcare nation something that we can all be proud to be part of. Thanks, Ben.
Thank you so much, Rick. I hope you have a wonderful day.